Question comes on adoption of the amendment. All those in favor signify by saying aye. Senator from Middlesex, Mr. Lewis. Could have just gone.
Thank you, Mr. President. I rise in support of amendment number 487. This has to do with school-based health centers. It is funding to support a specific school-based health center, which would be the Starr Center that we hope to open at Malden High School. But I do want to use this as an opportunity just to say a few words about the great value and benefits of school-based health centers for those who may not, those of my colleagues who may not be as familiar with them. There are currently 33 school-based health centers that are operated in our communities, mostly in high schools, sometimes in middle schools. They are operated by 16 sponsoring agencies that are either hospitals or community health centers or local health departments. They essentially function as satellite outpatient clinics staffed by most often nurse practitioners or physician assistants who are authorized to prescribe, and they are supervised by a physician and comply with national standards. From a recent report that looked at the benefits of school-based health centers, I just wanted to share with you a few of them because it really is quite remarkable. One of the main things that school-based health centers typically do is they integrate both physical health with behavioral health, and many times they also provide dental services as well. And remember, these are in schools and in communities where there are typically many students that are underprivileged, that have a difficult time accessing health care services. Many of them are immigrant students. Again, which makes it much more difficult for them and their families to seek the care they need. So having the health center right in the school, open during school hours, means that these critical services are much more accessible. As a result of that, students take more advantage of them, and here's just a few of the benefits from this recent study. Students using a school-based health center demonstrated a 50% decrease in absenteeism and a 25% decrease in tardiness after receiving mental health and counseling services. So that's a very significant impact on their school attendance rates. Adolescents with access to a school-based health center are 10 to 20 times more likely to make a mental health or substance abuse visit than students in a school without access to a school-based health center, which means that if they're going to make that visit, they're much more likely to then get the treatment and counseling that they need. Students using a school-based health center for mental health purposes increased their grade point average over time compared to non-users. So we're also seeing not just improved attendance, but as you might expect along with that, improved academic performance as well. School-based health centers are cost savers because they help to avoid unnecessary spending on emergency department visits. Students are able to get the care when they need it in school, avoiding more serious and costly emergency department visits. Furthermore, analysis has also shown that school-based health centers reduce teen birth rates, reducing the birth rate for girls 15 years and under by 23% and for girls 16 to 19 years old by 8%. So that is another benefit for school-based health centers who offer reproductive health services. So for all these reasons, I want to offer my strong support for our continued funding for school-based health centers. I do want to urge the Department of Public Health, which oversees the school-based health center program, to take a comprehensive look at the regulations that we have in place today. I do think that some of those regulations are in need of being reviewed and updated. For example, the regulations today typically make it difficult for a school-based health center to be open after school hours. And in some cases and in certain communities, it would be very helpful to have some hours outside of school time. and that might be an update we want to make. So I would hope that the Department of Public Health will work with the existing school-based health centers and health providers and members of the legislature to look at some ways to even further update and strengthen those regulations. But again, I want to say thank you for this support in this particular amendment for hopefully opening a new school-based health center which will serve the students at Malden High School and in the community. It is a very high priority for the mayor of City of Malden and the school community. Thank you very much, Mr. President.